Hello guys, welcome to our new video. So this video is going to be on the topic conductivity. So many students were asking about conductivity and wanted a dedicated video on the topic conductivity. So I thought of making one. So here we go. Let's begin with this topic. So the first question that comes to our mind when we hear the term conductivity, like mostly everybody want to know what is the definition of conductivity. And conductivity, the term conductivity comes from actually chemistry, and in chemistry the meaning of conductivity means it is the ability of a substance or a solution to conduct electric current due to the presence of free moving charged particles. Now, what are these free moving charged particles? They are ions or electrons. So this is the classic definition of conductivity according to chemistry. Now, on what other factors the conductivity depends? So it depends on number of ions present and the charge on the ions, like it can be positive, it can be negative, and the mobility of ions in the solution, how fast the ions can move inside the solution. So all these factors influences the conductivity. Moving ahead, now what is conductivity according to dialysis or in context to dialysis? So that was the previous was the definition, classic definition according to chemistry, but in dialysis it is a little bit different. So in dialysis, what does conductivity means? So conductivity is a measure of electric current conducted by dissolved electrolytes in the dialysate solution. So I guess everybody is aware about dialysis solution. Dialysate solution has dissolved electrolytes. So these electrolytes, what they conduct electric current. So that is what conductivity in dialysis means. Conductivity is a measure of electric current conducted by dissolved electrolytes in the dialysis solution. Now, because electrolyte dissociate into ions, so when the electrical current passes through electrolytes, they dissociate into ions, so they allow electricity to pass through them. And in dialysate solutions contain electrolytes such as sodium, potassium, calcium, bicarbonate, and chloride. Now you can see the above three are carrying positive charge while the lower two are carrying the negative charge, like bicarbonate and chloride are having negative charge. So these charged particles carries electric current. Another thing is that whenever there are more ions, there will be higher conductivity. We can say if there are less ions, there will be lesser conductivity. Less ions, less conductivity. But it also means that the solution will be higher, or we can say it will be diluted. So that is a point you have to remember, because several times there are questions related to this point. Moving ahead, what we have here, it says that the dialysate machine continuously measure conductivity to ensure what? So there is a function of dialysis machine to continuously measure conductivity. Now why it is so? Ensures that there is proper mixing of acid concentrate, bicarbonate, and purified water. So I think everybody is aware about dialysate solution, but if you are not, you should be, because we have to know that dialysate solution is made up of A part, B part, and RO water. Now A part is your acid part, B part is your base part, generally it is bicarbonate. Previously it was acetate, but now in current world we use bicarbonate. And RO water. RO water is purified water. So when these three mix together in a proper proportion, what we call that? We call that our dialysate solution. Now in what ratio they mix, there are several equations according to what they are generally mixed. So like in Derrick-Willow equation, which is most commonly used in most of the dialysis units around India. So it contains, this type of dialysate generally contains 1 part of acid, 1.83 part of bicarbonate, and 34 part of RO, and the complete dialysate has the equation of 36.83. Similarly, another common equation that is used is Fresenius. It uses 1 part of acid, 1 2 to 5 part of bicarbonate and 32.775 part of water. When they all mix together, we call such equation 35x or 35x dialysate. The above one was Derrick-Willock and we call it 36.83x dialysate. Moving ahead, typical range of substances in dialysis. Now this is very crucial because dialysate contains electrolytes we have seen earlier, but which substance they contains most influences the conductivity. So here we can see the chart. It says sodium is 135 to 145 milliequivalents per liter, and if we compare everything with sodium, they are quite low. Apart from calcium, everything I guess is lower or is on the lower side. So this is because this is why whenever we change sodium levels in our machine, the conductivity gets significantly changed. So this has to be understood. So next, what is important generally from the exam point of view, everybody should be knowing that the common range of conductivity lies between 12.5 to 16 millisiemen per centimeter. This is very important. Generally they ask this in exam, that what is the unit for measuring conductivity. So what this sentence is saying, it's saying its range of 12.5 to 16 millisiemen per centimeter is acceptable for standard dialysate solution. This range varies slightly from facility to facility depending on the dialysate formula used. The previous equations that we discussed in the previous slide. So it is saying, but typically it ranges from this. Now moving ahead, likewise I told you earlier, the conductivity, the unit of conductivity will be millisiemens per centimeter, and this is in dialysis. Now moving ahead, you can see this is our range and this is the reading of our solution. So this is inside this range, so there will be no alarm. But what will happen if the conductivity is out of this particular range? The alarm will start. So this is how alarm of conductivity happens in our dialysis machines. Now I will show you how this practically works. So in one video you will be seeing that there will be no alarm because conductivity will be in proper range. While in the second video, what you will be seeing that it will be giving alarm. In next part, we will be discussing important questions related to conductivity. So make sure you also watch that video because these questions are most important for the examination. Thank you. Hope you like this video. Make sure to like, subscribe, also follow our Telegram page, and practice sheet regarding this video will be available in our Telegram group. Thank you.